Hi everyone, my name is Dr. Uri Burstyn, and I'm here to talk to you guys about something that really should be essential knowledge for every pet owner. Uh, blood work. Why we do it, when we do it, and what difference does it make? And if I had to make a course for people to take before getting a pet, this would definitely be a part of it, because it's such an essential piece of knowledge that I feel like most people simply do not have. So please stick with me. I'm going to walk you guys through the indications for doing blood tests, the utility of doing blood tests, what the information they actually contain, and when it is appropriate to do them. But before we dive into it, please remember to hit the bell notification icon and squish that subscribe button so we can see a bit more of each other. And if you appreciate the work that I'm doing and want to support it, want to see more videos like this, please join me on Patreon. Your help is always appreciated, and I couldn't do this without my patrons. And I also offer second opinion consults through there. So, blood work. It's really a nebulous term that describes all the different blood tests, of which there's quite a large number, that veterinarians can offer our clients. And they're pretty much exactly the same blood tests that human doctors offer their clients. So I don't even know why I said veterinarians. Blood work is an essential tool in any doctor's toolkit, because when you look at an animal, you can only discover so much about them through a physical exam and history. In fact, the motto of feline veterinarians, the unofficial motto, is cats are masters of hiding disease. Cats will simply not show signs of illness until it's really quite advanced, and that has to do with their position in the food chain. They're a middle of the food chain predator, meaning that they have a strong masking reflex. When they don't feel well, they hide it, because if they don't hide it, something eats them. Other animals that have a really strong masking reflex that are common pets are things like rabbits, guinea pigs. They really try not to show anything that's wrong. But in reality, even a dog has a hard time complaining to its owner that its tummy hurts or that it feels slightly weak and nauseous. So blood tests are absolutely indispensable tools in assessing cats or dogs or any other pet's health. And there's a reason why they're called a part of the basic database. The basic database usually means blood work and x-rays. And these are just absolutely foundational tools in pretty much any investigation. Now, when we talk about lab work, sometimes we talk about blood work, lab work. We use these terms interchangeably. Often we include urine testing with blood, and I'll explain to you in a second why. But there's three main reasons why your veterinarian might suggest that you guys do lab work or blood work on your pet. These reasons are to diagnose problems, as a health screen, and to monitor treatment. So let's break those down. The obvious one is for diagnosis. You come to your vet and you say, "Doc, I think something isn't right." And your veterinarian hopefully does a thorough physical examination and collects an in-depth history and goes, "I agree, something isn't right." Hopefully, based on the information that they collected, they can say, "I think maybe something isn't right with this body system or with this body system." Sometimes they may not be able to say that, but they can do a blood test. And at that point, it becomes your first diagnostic step, your basic database. The second scenario is for routine health monitoring. Here we leverage the power of statistics. So this is most clearly defined in cats. We know that statistically speaking, cats start to develop old age diseases after the age of 8. So the American Association of Feline Practitioners recommends that every cat have blood and urine testing done once a year after the age of 8, because we know that we'll start picking up health problems on those blood tests, often years before the cat looks at all sick. And of course, that is the best time to diagnose and prevent problems, right? It's not when your cat's lost half its body weight and hasn't eaten it for a week. It's when there's this tiny little change in the blood values, and you can start fine-tuning their diet, fine-tuning their maintenance, increasing or decreasing certain activities, adjusting your monitoring schedule, maybe prescribing medication. They'll keep your cat feeling good and not knowing that there's anything wrong with them, which is, of course, always our main goal, is to have our pets not know that they're not healthy when they're dealing with disease, right? So that is, and I think that's kind of the one that's people have the hardest time wrapping their mind around, where they're like, "Oh, my cat's fine. Why do I need to do lab tests?" But the reality of it is that if on a statistical basis, on a population-wide basis, if you have like 100,000 people doing lab tests on their pets, you know that a lot more people and pets will benefit from doing them than not doing them. So it is absolutely a reasonable and valid and important strategy for maintaining animal welfare. And this is, I really want everybody to listen to me on this one, it will probably reduce the lifetime costs of taking care of your pet. So the main reason why people don't do monitoring blood work is because it's cost. It's like, hey, like my cat's fine. Why should I spend a couple $100 on it just to get blood and urine test run? But the truth of it is that if you screen, again, statistically speaking, if you screen your cat routinely, you will diagnose things earlier, and early diagnosis reduces costs of healthcare. This is proven without a doubt in human medicine. It's proven without a doubt in animal medicine. Early diagnosis through screening reduces overall lifetime costs of healthcare. And of course, if you're never going to take care of your pet, you're not going to spend any money on them. You're probably not watching this YouTube channel. I assume my audience are people who are actually really engaged with their pets' welfare and really want to take care of them. And if you do, then the best use of your resources when your cat's healthy is appropriate and regular health screens. And a part of that is your physical exam with your veterinarian every year. And a part of that is blood and urine testing at appropriate ages. With dogs, things are a little bit less clear. There are no clear-cut guidelines for when we should be testing dogs based on age. And the reason for that is because there's such a great variation between breeds. A giant breed dog like a Saint Bernard or a Great Dane might only have a life expectancy of 8 to 9 years. I know, it sucks, it's shocking, but it's true. And in those dogs, you can consider them geriatric after the age of 4. It's probably not unreasonable to start doing blood testing on them around there. I know that in my practice, I find a lot of, for example, early liver issues in dogs on routine blood tests or blood tests that we do for other reasons like pre-dental screens, right? Smaller breed dogs, like a Yorkie or Shih Tzu, might live to the age of 16 or 18. So you can probably start considering them geriatric after I don't know. There's no statistics on this. This hasn't been studied adequately. My gut feeling is probably after age of 12 or 13, you probably start wanting to keep track of them. And again, you might be doing blood work sooner than that. For example, as a preanesthetic screen prior to doing dental cleanings and stuff. So functionally, these dogs do often get monitoring blood work done throughout their life, even though we don't have a hard cutoff on their age. But you can see there's a huge variability there in terms of expected lifespans between breeds. So it makes making recommendations for dogs a little bit more challenging. And maybe this is kind of subcategory of preanesthetic blood works are also super important. You should always do a blood test prior to putting a patient under anesthetic. It doesn't matter if they're a kitten or a puppy or if they're an older animal, always do blood work prior to anesthesia. In my own practice, I make it optional for puppies and kittens before they're spay and neuter. It's for animal welfare reasons. It's because I don't want there to be a financial barrier for people to get their animals desexed. However, realistically, if you can afford it, it's still a good idea, because if your puppy or kitten have a congenital problem, if they're born with kidneys or a liver that's abnormal, it's much better to discover about it on a routine blood test, and you can adjust your anesthetics and they do great and you can manage it without any drama. That is way better than discovering about it when your patient's already on anesthesia and they crash and they're trying to die on you for no apparent reason. A lot of anesthetic complications happen due to inadequate screening. So always, always, always do preanesthetic blood work, even if your pet looks completely healthy, even if your pet is young. And then the third scenario in which we might want to do blood work is for monitoring health conditions. So blood work monitoring is absolutely an essential part of taking good care of a pet's health. And here is where veterinarians really, I don't want to say fail our clients, but more like face a big challenge in helping our clients, because we're really kind of stuck between a rock and a hard place. The rock being the inevitability of making medical mistakes if you don't do adequate monitoring on your patient, and the hard place being client resistance to paying for a lot of blood tests because money matters and it's often a challenge. With every health condition, every patient, the appropriate frequency of monitoring will be a little bit different. So it's hard for me to speak to that specifically. In veterinary practice, as far as I know, there's no actual hard data on how often we need to monitor patients, even for common conditions like diabetes or kidney disease. Certainly, I've developed certain practices in my own personal work that I think work really, really well. And again, I might talk about them in a separate video, but it's really important to realize that they're going to be, whatever I say in this regard is going to be a practice I developed personally based on my best understanding of medicine, how to help my patients, and not something that's based on hard evidence, because there simply isn't any in the field of veterinary medicine with regard to appropriate frequency of blood tests to monitor. We'd certainly have recommendations, but they could be anywhere from twice a year to once a week. So it's a pretty broad range there. What I am going to say is that when you take out cost and client concerns about like visiting the clinic too often and emotional stress out of the equation, we probably should be doing a lot more blood tests than we are. So Mr. Pirate, who has multiple health issues, and you can get really updated on them in my Mr. Pirate Health Updates videos. I'll put links in the description below. Mr. Pirate has a lot of health issues. I do blood work on him anywhere between once every 2 to 6 weeks, and I have done that for many years. I have never had a client-owned animal on whom I've done that much blood work. I have also never had a client-owned animal who has lived as long as Pirate with his multitude of health conditions. And I've definitely gotten a lot of value from doing them. So there's 100% benefit to proper monitoring. And it's probably going to be a little bit more intensive than your average veterinarian recommends, because they're just used to having people say no. Appropriate monitoring schedules for common health conditions is probably going to be a topic for a completely separate video that I'm going to link to whenever I get around to making it. But the general rule of thumb, if your pet has a chronic health condition, you should probably be seeing a veterinarian several times a year, not just once or twice. And you should probably be doing some kind of blood work several times a year, not just once or twice. And I know this would be quite different from many people's experience of veterinary practice, but I strongly believe that more monitoring really does produce better outcomes. And this belief is evidence-based. Now I'd like to just touch base on what it actually means when people say we're going to get some blood from your pet, because there's a lot that can go into it. So first of all, blood work typically involves, your basic database typically involves something called a CBC and a chemistry. CBC stands for complete blood cell count. And what it is exactly what it sounds like. You look at the number of cells in your blood. You get your red blood cells, different populations of white blood cells, platelets. You count them and you see if they're normal or abnormal. Very, very important information comes from that. The chemistry is mostly about electrolytes and looking for markers of organ function. Again, there's a lot of different chemistry profiles out there, but all of them are going to do, to greater or lesser degree, these two things. They're going to measure electrolytes, they're going to measure markers of organ function. So let's say if you have problems with your liver, problems with your kidneys, those markers will come up. That's your basic like blood test general panel that most vets will be recommending to you. Then there's other really common things like measuring thyroid levels. Again, this is part of every cat's geriatric blood test because elevated thyroid is such a common issue in them. Urinalysis, so looking at urine, measuring its concentration, and looking at the urine sediment, looking for what kind of cells are present in the urine. Also, again, really basic routine blood or lab test that most people are probably going to experience with their pets. All of this provides really basic information about how your patient's doing. Are they showing any inflammatory responses? Do they have enough red blood cells? Are they showing any evidence of organ damage? What it doesn't do is give you a diagnosis most of the time. So blood tests don't, a lot of people think that a lab test is like, you test to see if my pet has this disease. No, that's not really how it works. What we do is we test how our patient's organs are functioning and whether they have an inflammatory response. And based on that, we can extrapolate what a diagnosis and figure out what's wrong with them, or more commonly, know which follow-up tests are going to be useful to actually diagnose the issue. And again, this may be a topic for another video, the diagnostic process. I think it'd be really interesting for a lot of people to dive into that because it's not as straightforward as people think. And just a quick note, there's no like blood test for cancer. A lot of people think that, oh, you can do a test for cancer on blood work. You really can't. There's work being done in both the human and animal health field to look for biomarkers of cancer. And there's definitely some progress made on that. But in general terms, using traditional blood work, you don't test for things. You just evaluate how the patient's doing. It helps you rule out some diagnoses and maybe suspect other ones. And there's no specific test for cancer. Now, if you have cancer in your liver and it's affecting your liver function, you will see elevation in like liver values. And you say, okay, we need to look at the liver somehow, maybe with an ultrasound, maybe with a biopsy. And that's how you diagnose cancer. So that's a really common misconception that I would love to just people kind of be aware of. So that's a basic database. And then of course there's a bazillion specialized blood tests out there that are usually recommended in special conditions. You can test for specific pathogens, or if you suspect a given infection. You can do special tests for specific organ functions to measure different parameters of every different organ. And that's usually kind of second line of an investigation, where you get your basic database. You say, something's wrong with the kidneys. Okay, then. Now we can do a couple follow-up tests to see exactly what is wrong with the kidneys and how bad it is. And again, this is where one often gets a bit of friction from clients who start talking about, like, oh, you already did some blood work on it. Well, you got to do another test. Now you got to do another test. What's going on here? And reality of it is that tests are done in a stepwise fashion, and you build one test on top of the other to get to a point where you actually can know what's going on inside of this incredibly complex biological machine that we call a dog or a cat or a human or a rabbit or a lizard. So it's absolutely normal and appropriate to do follow-up blood tests based on the results of your initial screen. It's just a part of life. That's the way it works. And just like all tools, you got to use them in a correct fashion at the right time for them to do some good. And here's probably a good time to just touch base on the cost of blood work, because unfortunately, like everything we do, costs money, and veterinarians always have to deal with the fact that not everybody has infinite resources to take care of their pet. Normal part of our life, totally okay. And there's one thing I wish that all of my clients would do, is to be honest with me about their financial limitations. I know it's very hard to talk about, but there's absolutely no shame or problem in saying, Doc, I've got limited resources. This is what I got to work with. Let's see what good we can do. There is absolutely shame and horror in blaming a veterinarian for being expensive just because you can't afford what their recommendations are. Because chances are your veterinarian is really just trying to help you and your pet. And yes, stuff costs money, and it's not the veterinarian's fault that's the way life works. So I would really love people to kind of know the incredible amount of work and skill and compassion and thought that goes into even something as simple as a basic blood test. First of all, venipuncture. You got to get blood out of a dog or a cat, for example, or maybe a lizard or a frog or a rabbit. We've done all of those probably in the last week in my clinic. That is an incredibly refined skill. It is really, really hard to do. It's even harder to do when the said dog or cat is trying to kill you. So they need staff to draw blood. You need staff to restrain the animal in a humane and effective fashion, which is not as easy as it sounds. Sometimes it can be really quick and easy, but getting blood out of a terrified, aggressive, 12-pound cat is actually very dangerous. And trips to the hospital are not uncommon. Everybody who's worked in veterinary practice has either experienced a trip to the emergency room for a cat bite to get antibiotics, or knows somebody who has. And sometimes it can be quite severe. I mean, I have a video on my channel about getting punched in the eye by a cat. That is really, that was a close call. It could have been much worse. It's just a part of working with animals. So just getting blood from an animal already requires a bunch of trained staff, often a significant amount of time that has to be paid for, and is a really, really difficult skill, much more difficult than getting blood out of a compliant human who's just sitting there. So there's that. Then that blood has to get shipped off to the lab, where it gets processed, reviewed by a pathologist, run through a bunch of machines. That's your lab fees. And then those results get sent back to the veterinarian, and now they have to interpret them. And this is actually where you really get to be a doctor. If I had to like summarize a doctor's job in like one sentence, I would say interpreting. In fact, that's actually just one word, but really that's the work that your veterinarian should be doing. They should take these results, interpret them, integrate them into the history and the physical exam findings, use them as to manage the case, to figure out how to help their patient. And then the next stage, we're not done yet, is to communicate those results to the client. And might be the hardest part of the whole affair, is to communicate those findings, to educate our clients on what they mean for their pet's health, what the next rational steps are based on them. And I probably spend 60 to 70% of my day on the phone or in the room talking to clients, telling them what lab results are. That is the meat and potatoes of my work as a clinician in the veterinary field, is talking to clients, explaining things, and educating them. And they're going to put a little flag up for all of you guys. If you ever want to test your veterinarian and know if you have good veterinary support, how much time they spend with you explaining things. Being able to explain results and problems and educate the client and help you, the client, understand what is going on with your pet is absolutely the most important marker of a competent and caring veterinarian. Really, nothing else matters. Ultimately, you need a vet who can communicate with you in accurate and effective fashion and help you make decisions about your pet. And if you have a veterinarian who isn't spending time with you on the phone or in the room and explaining things, then you probably don't have a very good veterinarian in your life. Because again, it is hard for me to overstate the importance of that step and the challenge of that step, because sometimes I might be explaining a really complex endocrinological issue to somebody with maybe a high school science or less understanding of science and biology. And that's just a challenge of life. And it can be done, and you can support your clients even if they don't have any medical or scientific background. But boy, is it a lot of work sometimes. So yeah, that is like definitely the biggest part of it. So hopefully now you'll get a little bit more of an appreciation for what's involved in doing lab work and sort of why and when we do it. Thank you for sticking with me this far, because again, I know this might not be the most exciting topic on my channel, but I do think this is an incredibly important one for people to understand so they can take better care of their pets, because that's really what this YouTube channel is all about. And I just want to finish this with one question that every, I think, veterinarian dreads, and that's, are we doing too much? Are we doing too much testing? And the answer to that is going to be categorically no. That never, ever, ever is it going to be such a thing as too much testing. As I mentioned earlier, there are no clearly defined monitoring parameters for most health conditions in pets. But I promise you, and if you guys trust me on any topic, please trust me on this one, that there's no such thing as too much monitoring blood work. If you have a veterinarian who thoughtfully uses it and interprets it, integrates into case management, and communicates it back to you, you probably cannot do blood work often enough. And just guys, frame of reference, a human in a hospital with a serious health condition might get blood draws 3 times a day for weeks. We're literally talking about hundreds of blood tests. And there's a reason for that. It's because it creates better patient outcomes. And cats and dogs with exactly the same condition might get 1 blood test or 2. Veterinarians do not do too much blood work. And if you ever feel like your vet is doing too much blood work, ask yourself, are they explaining the results to me? And are they telling me what difference it makes? And are they making decisions based on this? Are they changing something or telling me that something isn't changed? If that is the case, you're not doing too much blood work. I'm really hard pressed to think of any time where I did a blood test on a patient and I said to myself, maybe that was a waste of time and money. It's always useful. So please don't torment your veterinarians with that question. You can torment your veterinarians with a million other questions that they'll probably be happy to answer, but please, not that one. So on that note, thank you very much for watching. I sincerely hope you found this video useful and helpful. If you have questions for me, feel free to leave them in the comments below. And I sincerely hope you and your little furry and scaly friends have a lovely day. Please remember to squish that subscribe button and pet the bell notification icon so we can see more of each other. And don't forget to like and subscribe and share this video with anybody you think might find it useful. And if you want to support our public education work, then please head over to Patreon, where your support is much appreciated. And I also offer second opinion cases if you need my help with your own pet's medical issues.